Good morning, everybody. Welcome. Today, we're so pleased to have all of you joining us for this important informational and educational session. I'm Lisa Stefanowski. I'm the Health Officer for the Ottawa County Department of Public Health, and I'm excited about what we have to offer today. We recognize that due to COVID, this past year and a half has been so difficult for everyone, especially parents and students and school personnel. I think we all hoped that we would start the school year in a different place without increasing numbers of cases and a COVID variant, but here we are, and so we just want to be prepared to go back to school in the safest way possible with an abundance of information to keep our families and our children safe. Ottawa County and Kent County Health Departments have received so many questions over the past year and a half at board meetings and through email and phone calls. We want you to know that we've heard you. These phone calls and communications have shared a range of concerns about the impact of COVID on children's health and well-being, and the challenges that many of you have had with some of the COVID prevention measures that have been put in place. Local health departments across the state of Michigan, including Kent and Ottawa, have worked tirelessly alongside our hospital and healthcare partners to keep our communities safe, and that's really what we want to continue to do. We all know that there are many places to go for information out there. It's hard to know sometimes what information we can trust, and so today we want to bring you our local medical experts to help answer some of those questions that we've heard from all of you, to really help you with the best and most credible information from a trustworthy source.
Thank you, Lisa. Good morning, everyone. I'm Dr. Adam London, Director of the Kent County Health Department. And I know because you're watching today that you share our love for the children of West Michigan. And I know that we all have a common shared goal to make sure that they are thriving, they're growing, they're learning, they're happy, and they're as safe and healthy as we can make them. To that end, having great information, high quality information from reputable sources is critically important to us. And I know it's critically important for all of you as well. Here at the Kent County Health Department and our friends at the Ottawa County Department of Public Health, we've been relying on that high quality data and information and on institutions and organizations that have that same commitment to that level of quality information throughout this pandemic. One of the ways that we've done that is by creating a local advisory group or a number of counselors here locally from medical and science fields that help us to interpret and to understand the data and the information, help us to process it so we can put it into a form that helps us to apply the information to the decision-making that we have here at the health departments, and also so that you can use information in making good decisions for you and your family. And so we do have a number of people from that medical and science work group that are joining us today. And I'll turn it over to our facilitators to begin that conversation.
Thank you so much. Good morning. My name is Michelle Napier-Dunnings. I'm Chief Communications Officer at MPHI. MPHI is a nationally engaged Michigan-based public health institute, and I and my colleague, Michael Williams, Michael, would you wave, please, will be facilitating and asking questions of our expert panelists. And this morning, just in case we've had a few technological glitches, if I fall off, Michael will pick up and continue with the questions. So we're going to work together on that. As we begin, I want to reiterate a couple things. One is I will be asking questions of the panelists that have come from all of you. Over the last probably year and a half, questions have come into both of the county health departments, and we pulled those questions and put together those that have been repeated multiple times and those that need to be answered right now. And we'll be asking those of the panelists. I'm also want to remind you that this is being recorded, and you will be able to find this recording on both the Ottawa and the Kent County Health Department websites, and also on Vaccinate West Michigan website. You saw that in the initial pictures. We will show it again at the end. Please, please share with friends, family, colleagues, so that as many folks can hear this information as possible. Okay, so to begin, I am going to begin with Dr. Nirali Bora, who works at Kent County Health Department. She will introduce herself and then pass it on and have each of the panelists introduce themselves before we start asking questions. Dr. Bora?
Good morning. Thank you for having me here, and to all of you who are able to join us this morning. My name is Nirali Bora. I'm a family physician and the medical director of the Kent County Health Department. We've worked closely with school districts to provide them with guidance and support throughout the pandemic. Since last fall, we've been fortunate to have a group of local physicians review our guidance and ensure that it meets the needs of the children in our community. These physicians represent a range of specialties, including adult and pediatric infectious diseases, outpatient general pediatrics, adolescent medicine, pediatric emergency medicine, and pediatric intensive care. Their experiences and knowledge have helped us provide the best recommendations that we can from what we know right now. I'm so grateful today to have three excellent physicians who are well respected and trusted by their colleagues and the community join us today. I'll ask each of them to introduce themselves with their name, title, and area of expertise, and then to start, share a few comments about what they're seeing regarding children and in keeping them healthy and safe. So I'm going to go ahead and start with Dr. Oliveiro.
Hi, good morning, everyone. My name is Rosemary Olivero. I'm a pediatric infectious diseases physician at Helena Boss Children's Hospital of Spectrum Health, and I'm the division chief of medical specialties at the Children's Hospital. I'm also the mother of three young children who are in elementary school. My initial remarks are that after a summer of feeling relaxed and a bit carefree, we are obviously gearing up for what we hope to be a successful school year. And very happy to have the data and experience that the 2020 to 2021 school year afforded us so that we can help plan for a successful school year to keep our children as well as our community at large healthy. Thank you.
Great. Thank you, Dr. Oliveiro. Dr. Brown?
Hi, I'm Lisa Brown. I am a general pediatrician in private practice in the Grand Rapids area. And I also serve as medical director of a pediatric physician organization that has practices throughout West Michigan. So I'm happy to be here and happy to answer any questions.
Wonderful, thanks. And Dr. Jamison?
Hi, my name is Andrew Jameson. I'm an adult infectious disease physician at Mercy Health St. Mary's. Here, I'm the regional medical director for infection prevention and control, and also the division chief of infectious diseases. I've been lucky enough to be part of a bigger group for Trinity Health, which has 90 hospitals across the country in 22 states, where I've been on a few of the committees that we were trying to tackle COVID as an organization nationally. So I've been living and breathing COVID, and like Dr. Oliveira, I appreciate the experience we've had over the last year and really 18 months to give us kind of a lot of guidance and framework for what we're looking at moving forward. And my hope is that we can do everything we can to keep our kids safe, but also keep our kids in school. I think all of us have seen what it's done to our kids when they were virtual. It's hard on them. And I think that there are varying degrees of success being virtual. So a lot of what we're going to talk about, and I hope we can get some guidance on and move forward with, is how to keep our kids safe and kind of getting the education they need. So I have 4 kids, 2 10-year-old twins. I have a 13-year-old and a 15-year-old. So I have high school, middle school, and elementary school. So I feel everyone's interest deeply here.
Wonderful. Thank you all. Great introductions, and I'll go right to the questions. Dr. Oliveiro, how does COVID affect children? How does it affect the child's family and community? And are you seeing anything different in COVID cases among children since the arrival of the Delta variant?
Great, thank you for that question. This is certainly on the front of all parents' minds and those who interact with children on a regular basis. So when we talk about how COVID affects children, I like to break that up into the direct and indirect effect that COVID has on children. So when we speak of direct, that's really thinking about the acute medical illness that children can directly have if they themselves become infected with COVID-19. So as we know, over the past year and a half, children do not have nearly as high of a likelihood of getting severely ill from COVID-19 and ending in a healthcare setting because of that, meaning coming into the hospital to need medical care directed at that acute respiratory COVID. Now, that did vary over the course of the 18 months that we've been in this pandemic. Early in the pandemic, children were less likely to be tested for COVID-19 because of testing availability issues. And the vast majority of children were not terribly ill from the virus. Now, when the surge of COVID-19 came in our community in the spring of 2021, that was a bit of a different picture. First of all, children made up a much larger proportion of those infected with COVID-19. In some parts of Michigan, up to a quarter of the COVID-19 diagnoses were among children. And we also saw that children were more likely to come into the hospital with very severe COVID-19, some of them even needing maximal life support in our intensive care unit. So that certainly gives us pause in understanding that children certainly can be severely affected with COVID, and that was seen here locally. Luckily, we were prepared to diagnose and treat those children, and we had good outcomes with those who came to medical care promptly. Now, as we head into the fall months, we certainly are seeing more children becoming positive with COVID, and knowing that Delta is by far and away the dominant variant across the country, as well as in Michigan, we expect to see more and more children becoming positive, and some of them may indeed need to come to the hospital. We have had some children in the recent weeks come to the hospital infected with acute COVID. But even more than the children that I just mentioned, we have cared for in the hospital environment steadily throughout the course of the last 18 months, children who have come down with the multisystem inflammatory syndrome in children, or MIS-C, which in a large portion of the cases is a life-threatening post-infectious inflammatory condition that comes anywhere from 2 to 8 weeks after the child has acute COVID. And even children who don't even know that they had COVID, they were so mildly affected with the initial viral infection, many of the parents didn't even know that their children had COVID. And it's an extremely important medical consequence of COVID-19 in children, because like I said, many do require intensive care and very sophisticated medication management to help them survive this life-threatening condition. And then the last piece that is known to happen in children after having COVID is something called long COVID. This is a syndrome that has been called a few different things. Initially, it was called being a COVID long hauler, but now it's been dubbed long COVID. And this is a range of cognitive, or how you process information, psychological, or how you feel emotionally, as well as having things like failure to get back to your normal activities, because of cardiovascular issues, having changes in your blood pressure when you stand up rapidly. And this can range from anywhere from 5 to 10% of children who have acute COVID. It varies quite a bit from state to state, but on the whole, in the United States, that's about 5 to 10% of children. And it's not like just something like, oh, hey, it's taking me a while to get over and kick this. These children do actually need to come in to be seen by a specialty team, often need to be cleared by cardiology to resume their normal activities. So this is a really important thing for us to think about, especially in our athletes and those who want to continue to exercise. Having that disruption to their life can even compound further the issues from having had COVID-19. So those are all the direct effects of COVID on children. There are also quite a bit of indirect effects, and this is really a large topic, but comes when we think of the disruption to the lives of children because of COVID-19 on our community. And this ranges from school closures to needing to be educated virtually or having disrupted in-person education. Also not being able to participate in the normal activities that bring children structure and give them a sense of thriving. But then also the amazing impact of death and disability of family members on children. And that can have a very disruptive effect on children if they're orphaned or lose a loved family member because of COVID-19. At this point, we are seeing more and more cases of the Delta variant causing COVID-19 cases in the state of Michigan. I think we're just at the tip of the iceberg right now, so the next few weeks will be very telling. We do know that from our colleagues in the southern states that the numbers of COVID-19 in children are really surging at quite astronomical levels, have led to quite widespread quarantines and school closures. And we certainly do not want the same fate to befall us here in West Michigan. We do not know yet whether the Delta variant causes more severe disease and hospitalization in children. We know that a vast number of children are infected at this point in time in the southern states. I cannot yet give you a precise estimate if the hospitalization rate has increased from the Delta variant in children yet.
Thank you so much, Dr. Oliveiro. Dr. Brown, could you expand a little bit on the long COVID experiences you are having, and also the issue that Dr. Oliveiro brought up about the well-being of the child? I think we're all concerned not only about the physical implications, but also the mental health implications and children getting to be children. So could you talk a little bit more about that?
Yes, thank you. I'll answer the first question first. We do have several patients in our practice that are experiencing long COVID. Some of the symptoms that Dr. Oliveiro referred to, difficulty with changing positions from lying down to standing up, with changes in heart rate, with extreme fatigue. Teens who are finding they don't have the stamina they did, so having more difficulty exercising, doing their athletics, even if they have normal EKGs and normal pulmonary function testing. So as Dr. Oliveiro said, we're referring those children to the team at Helen DeVos to support them and work with them. We also have several teens in our practice who have lost their sense of smell and taste, and that's going on over a year now. That's very frustrating and distressing for them. And there isn't a lot of data yet to tell us how to help them. So that's what we're seeing in our office as far as long effects of COVID. Your other point is extremely important. I don't know that we have ever had a year like we've had for mental health in our practice, and we're seeing that across the country and across the world if you look at the literature. So I think going back to Dr. Jameson's early remarks, one of the most important things I feel we need to do is make sure our children can be in school if possible. The children who were able to attend over the last year in person have, on general, fared far better than the children who couldn't attend or who had a lot of disruption. And so I am concerned about the whole child and what isolation does to them, and the mental health effects we're seeing from that.
I'm going to ask one follow-up.
Sure.
As parents, the tendency to want to protect is so strong. And at the same time, you're saying that we need to allow them to engage. And so I would just say, in terms of that, how do you inform us as parents to take a deep breath and know that we're keeping our children safe, but also helping them have a stronger sense of being able to live their lives?
Yeah, that's a great question. And I think it goes to another topic we're going to discuss, which is how effective masks have turned out to be for this virus. You know, I think early on, we couldn't have anticipated they would be so effective. And so I think having that knowledge that the masks help or that they work and that allows children to engage. You know, I've been so impressed with my young patients, what a great time they've had at school and activities with their masks on. And, you know, we saw very low transmission within the schools last year. So I think we're going to have both. I can keep our kids safe, but also look out for their entire well-being is how I look at it.
Thank you. And we will return to some more strategies for keeping our children safe and keeping ourselves positive about how to continue moving through as their parents and friends. Thank you. Dr. Jamison, in West Michigan, we're beginning, and beginning is probably the wrong word, we are seeing spikes and surges in cases again. What do you anticipate will happen this fall? And would you recommend following CDC guidance now or wait until the spike gets higher?
This is a good question, and I think it's multifactorial. So I think the big thing for me is we are in a better position now than we were last year. And that's even with cases being higher than they were last year in August. One of my colleagues at work actually said that, I had a birthday present. My birthday's on September 20th. It was our first day in months where we had 0 COVID patients in the hospital. And that was on September 20th last year. So that it really shows that right now our cases are a lot higher. And we're going into the fall with cases worse than they were last year. So that seems doom and gloom and seems terrible, and we're starting things worse. But what we have this year is experience. We have knowledge about how to deal with this, and we have a huge amount of our population vaccinated, which is a big deal. So even though some of these rates are going up, and Delta is different. Delta is behaving different. I think one thing that's really important for listeners to realize is that the viral load is so much higher in Delta in infectious individuals, and the rates of transmission are so much higher that a lot of the things we experienced last year are going to be difficult to translate to this year until we see it happening. So that being said, the vaccine is giving us a huge amount of protection. So the amount of cases we're seeing in the community last year translated to big numbers in the hospital. And when we were at the same rates as we are right now in terms of cases in the community, we were getting overwhelmed in the hospital already. And that is something we're not seeing. We're seeing numbers go up. I mean, we had very few cases at St. Mary's back in June and early July, and we're up to 15 to 20 people sick every day in the hospital. Most of those are unvaccinated, but what we're not seeing is the same proportion of people that have a positive test being extremely ill. So I think right now we're positioned better and worse. Our numbers are higher going into the fall season, but our overall protection in the community is better. Could it get even safer? Absolutely. And I think that our vaccine numbers need to be higher. I think individuals who have previously been infected, I think they get a lot of reassurance from that previous immunity. And I think that is well-founded in some ways. Individuals who have been previously infected do have milder cases if they get COVID again, but the protection is not the same as vaccination. And getting vaccinated after you previously had COVID bumps up your immunity significantly and gives you an extra layer of protection that will prevent transmission, prevent getting it, and also keep everyone around you safer. So I really think that we need to stress getting more people vaccinated in our community, and that'll make the fall even better. I think you were saying, what do we anticipate happening? We know that the South is really experiencing a massive surge right now. And we're seeing numbers in the South that are exceeding hospitalizations from what they did in the previous surge, which was in the fall, like right around Christmas, Halloween to Christmas kind of area. That's happening down there because of the degree of Delta's infectivity, combined with immunization rates and the fact that everyone's indoors because of air conditioning. The thing that worries us in West Michigan is that right now we can be outside a lot. There's a huge protection from that. We're getting together with friends outside. We're going to the lake on the weekends. That's not where transmission's happening. Transmissions really happen in enclosed environments and inside areas where you have multiple people together in a close situation. And unfortunately, that's what our fall leads to. And so that's what my biggest worry is for our unvaccinated populations in terms of how sick they're going to get if they get Delta, but also just in terms of our overall numbers going up dramatically as we go into the fall. So kind of a long-worded answer saying I'm both optimistic and nervous. I'm optimistic because our vaccines offer amazing protection against bad outcomes. And I'm nervous because we still have a bunch of people unvaccinated and they're going to bear the brunt of the fall. And that makes me nervous.
Thank you, Dr. Jameson. Dr. Bora, I would like to offer you an opportunity to comment on any of those questions and add information from a public health perspective, as well as from a direct service perspective, and any advice or what you have seen in terms of children's resiliency. When we talk a lot about how kids go through a lot and they are able to continue managing things. I think sometimes they bounce back faster than we do as adults. And just what you've seen or any comments you would like to make about how, again, to support that resiliency, as well as anything you've seen from the overall public health perspective.
Sure, I think, I agree with what my colleagues have said, but really we've learned how to protect ourselves, protect our children from COVID. And so I think really keeping these lessons forefront, even though everyone is tired of it, I think we know what to do. We know that masks make a difference. We know that keeping a distance indoors makes a difference. Gatherings outdoors make a difference. So if we can go back to all these things that we were doing so well last year, if we can continue that for a little bit longer until our children have a chance to become vaccinated, I think we're going to be setting ourselves up for the best potential situation going forward. I think you speak about resilience, and, children are resilient, but this has been going on for a very long time. And so, one thing Dr. Oliveiro mentioned was the loss of a family member is devastating. And as we see our cases rise, we will see more deaths in those who are unvaccinated, especially. And that has a profound impact on the children and their families and their friends. And that is not something that children can recover from easily. So I think some of the things that we can do going forward is that, first, I think as parents, I have 2 children as well who are, elementary age, but we need to take care of ourselves. If we have mental health issues, if we have financial stressors, how can we as parents and caregivers be best equipped to provide the nurturing we need for our children? I think social connection is vital, but how can we do that in a way that's safe? Children need other people in their lives. How do we do that outdoors? How do we have them go to school? We don't want them to miss school. How can we prevent them from getting sick, from getting COVID, other illnesses, so they can really thrive in school? And I think asking for help when it's needed. We have mental health professionals in our community who are there, willing, ready to help out. Sometimes the additional help from someone on the outside is just what a family needs to get through a challenging situation or a child's challenging situation at that moment. And then finally, I know you're hearing this a lot, but if we can protect the children who are most vulnerable, those who are not able to be vaccinated, if we can cocoon them with people who are vaccinated, if parents, grandparents, aunts, uncles, friends, if we can all get vaccinated because we can, we're going to protect those children from losing one of us. We don't want them to lose us. We'll prevent them from getting COVID from us. So these are all steps as parents, as caregivers, family members that we can take to help our children. But, we need to pay attention, watch for signs that our children are not doing well, and really be perceptive and reach out when we need to do something.
Thank you very much. Dr. Bora, you've answered the next question, which is, what are some ways that parents can protect their children who are too young to be vaccinated? I would like to ask the other panelists, is there any other strategy other than what Dr. Bora just said that you would like to add?
This is Andrew Jameson again. I didn't answer my last part of the question, which is, should we start recommending following CDC guidance now? And the answer is yes. And I'll tell you what I'm doing in my own life. So I have myself, my wife, and my 2 older kids are vaccinated. So that's myself and my 13 and 15-year-olds, but my 10-year-olds are not. They're not eligible yet. And so I'm trying to find that balance in life of like not locking them away, letting them have fun, be with their friends, do things like that. And so we're trying to be in scenarios where we're controlling the environment. So am I eating outdoors when we go to dinner? Yes, I am. Are we going into scenarios where my unvaccinated 10-year-olds are with a huge group of kids where we don't know what their symptoms are, don't know what's happening, and are unmasked? I'm not anymore. And so my 10-year-olds do mask when we're going into scenarios. And over the past few weeks, the rest of us in our family have, when we're going into indoor environments where there's a large group of people and we don't know what vaccine status is and don't know what people's symptoms are. So that's what I'm doing in my personal life to answer that next set of questions, because it falls in really nicely with what the CDC recommends too. So I think everyone's very discouraged about what vaccination means now that we have Delta. And I think there's a lot of people that are saying, like, why would I even get vaccinated if it's not protecting me? And that's just not quite accurate. So Delta is definitely causing infections in vaccinated individuals that we never saw before. We did not see these levels of infections in vaccinated individuals with the predominant variant previously, which was the Alpha or UK variant. And so Delta is behaving very differently. However, the protection at severe illness, death, and even getting regular just symptomatic infection is dramatically better with vaccination than not. And so that protection there is huge. And frankly, in my life, I can't wait to get my 10-year-olds vaccinated.
Thank you very much. Great suggestions for all of us, whether children or adult, in terms of things that we can do. Let's talk a little bit about masks specifically. That is a issue that has come up many, many times in the questions that have been submitted. And Dr. Brown, I'm going to go back to you next. We've received many questions about the effectiveness of mask use in preventing transmission of the virus. What would you say to parents and community members who aren't sure that masks are effective? Why are they? Why do we believe they are? We hear concerns from parents who are worried about their children having to wear masks all day. What should parents be aware of? Are there negative health consequences of wearing those masks? So can you talk a bit about the effectiveness, and also are there negative impacts of wearing the mask?
Sure, thank you. As I mentioned briefly earlier, there is a lot of data about how effective masks are, which is a wonderful thing and really helped us last year. The reason masks are so effective has to do with the size of the viral particle itself and the droplets in which it's transmitted, and how effective masks are at blocking that both ways, both blocking the droplets if someone is ill from passing it on, and helping to protect someone who might be exposed. It has been a gift, I think, and as I said, I think it helped us get through the school year last year, in addition to the other measures that were put in place. So there's a lot of data about how effective masks are. I do have a lot of parents who ask me, is it harmful to my child? Worry about, is it harmful, breathing your carbon dioxide? And there's no data that it's harmful. If we think about, in the medical setting, we've all been using masks. It goes back over 100 years. So masks have been used in hospital settings and infectious situations. Surgeons wear masks all day long. Anesthesiologists wear masks all day long. Our ICU docs we're masked all day long. And so I'm not worried about negative health effects from wearing masks, for children wearing masks in schools and social situations. And also I get asked a lot, is there harm to their development? At school, they aren't seeing their teachers' faces or their peers' faces. And we have not seen any evidence that development has been negatively affected. Even my patients who have speech delays and other developmental delays have actually done really well through this year. I think if they're able to be in school with a good support staff, they continue to make their gains in development. And I have just not seen any negative effects in that way. But I do get asked it a lot, and I understand the concern.
And we're just not used to it. And so it feels odd and not normal somehow. But
sure.
Thank you. Yeah, go ahead. Sorry.
No, I was just saying, and we're all ready to move beyond it. But luckily, we're not seeing negative health effects or developmental effects in children.
Thank you very much. Dr. Oliveiro, could you continue in that same theme about the masks? Anything that you would like to add, as well as could there be differences in parents' choices on whether to mask, distance, or quarantine? Because we know we have different opinions about this, how does it affect the health of the student population in a school setting? We're talking about how important it is to get back to school. So could you talk a little bit about our choices as parents and the impact in the school environment?
Right, absolutely. So I think we all like to call back to numbers and data to help us kind of wrap our heads around the effectiveness of masks in the schooling environment. And fortunately, there is a large body of data from many different investigators through the 2020 to 2021 school year that looked at the transmission of COVID-19 in schools, even during some of our highest peak transmission of COVID-19 in the communities where those schools were in. And so there's a very large body of data, like I mentioned, from many different investigators. So it's nice to see that replicated in several different environments. So when we look at even when community transmission, the percent positivity and some of these communities was ranging above 15%, 20%, even above 25%. So really widespread transmission of COVID throughout the community. In those schooling environments, the secondary transmission of COVID-19 within the school was extremely low. Across the board, we're looking at less than 2 to 4%, and even in some environments, less than 1%. Meaning that if someone came into the school unknowingly harboring SARS-CoV-2, the virus that causes COVID, the likelihood of them transmitting to others within the school was extremely low. And it was actually, one study looked at it to see if it was, they tried to suggest even if it was more protective for the child to be in school with all these precautions, rather than being at home or in the community where the transmission was going on in such a widespread fashion. And actually showed that being in the schooling environment with all these precautions actually was much more effective in preventing the transmission. So now it wasn't just masking in all of these studies. These schooling environments had layers of mitigation strategies, masks being one of them, but also really working on their ventilation, the social distancing, meaning we're trying to keep the desks spaced out at least 3 feet, but in many cases 6 feet, using frequent sanitation practices, et cetera. And now, so you might say then, well, how do you know that the mask was the most important thing? And in all honesty, we can't point it to one thing and say that was the most important, because there were so many different preventative strategies going on at the same time. However, I thought it was very instructive looking at the North Carolina experience of their publicly discoverable study on this, was that when they did have a school outbreak, they were always associated with incomplete mask use in that school setting. So no one has done the study to say, hey, if you do everything else, but you take the mask away, what is the effectiveness? But I think some of those real world experiences, I think, were very instructive in showing us that masks are incredibly important. The second thing I want to mention is when we're looking at physical distancing of 3 versus 6 feet in the classrooms, when we saw all these mitigation strategies together, some schools ended up having more kids in the classroom and ended up changing from 6 feet of distancing down to 3, while keeping everything else consistent. And we saw that the transmission actually did not increase with decreasing the distance between individuals. So although it's not perfect, I think very large population data does suggest that using the masks in the school environment can be very helpful. Now, as Dr. Brown mentioned, one of the main benefits of wearing a mask, yes, there are some benefits to yourself in terms of reducing the likelihood that you're going to inhale infected respiratory droplets. And even if you do, you actually inhale less of an inoculum of that viral particle, and you actually tend to get less severely ill if that happens. But the real benefit is in capturing infected respiratory droplets that are expelled from the person, and it gets caught inside the mask. And as Dr. Brown mentioned, this has been the case and has really been the pedestal of infection prevention within our hospital environments for decades to centuries. That is the way that we can prevent spreading it to other people. So not everybody knows, especially a child doesn't know that they're sick with COVID. And so using a universal mask approach really takes out the variability there and really helps to protect all of those in the environment around you if you unknowingly come into the school harboring COVID-19. And I think that's incredibly important, especially for our children who tend to be less symptomatic. So I hope I answered your question. Please let me know if you have follow-up.
No, that was, you did very much. And I think maybe the follow-up is, if I'm struggling as a parent to put a mask on my child and thinking about their friends at school and how they get to interact with children, that sense of what that does for them, maybe going back to mental health and resiliency and feeling normal, feeling like they're part of their community. Have you had any conversations with patients or parents about allowing their child to be able to be integrated into the community they want to hang out with?
Exactly. I think that's a really great point. And I think that really, I think of masks, of course, it's a bother for some, but it is a tool to allow us to be in that environment. if it's going to keep our schools open and operational, that is extremely powerful. And I think that is the most important thing when we think about the health and well-being of children. So if we can use masks as a tool, not as a hindrance, I think that's incredibly important. And talking with our children very explicitly about that and modeling that behavior for them, modeling that behavior amongst their friends as well, and seeing that it can be normalized and really be an effective way to keep them in the school. I think that can be incredibly powerful. And I also like to say that, children are extremely smart. They pick up on our cues and how we're talking about things very easily. And children also have a great sense of empathy. So when we talk to our children about what they're doing for their community, how they're protecting their grandparents, how they're protecting people in nursing homes, they understand that. And so, we think of children sometimes being just very egocentric, which sometimes they are depending on the age, but I think they have an immense capacity for empathy, and we should feel proud of helping them help their community.
Thank you. Thank you very much. Dr. Jamison, when do you think the vaccine will be approved for children? What should parents know when making the decision to have their children vaccinated? Can you explain for us if the vaccine is still considered experimental? I guess I'm asking probably too many questions at one time. Let's start with the first one. When do you think the vaccine will be approved of for children?
So the next group up will be the 5 to 11-year-olds. Those are the trials that were started the earliest, and we're hoping to get some more information out probably by the end of September is what I've kind of heard, but that I don't think we know that for sure. So the 5 to 11-year-olds are the next group that are coming up, and we should get some information there soon. I would say that I do want to tackle the experimental question in the difference between an EUA and also for a full FDA approval. Like, what's different about that? One of the biggest things that's different is that for an EUA, you have to show data and you have to show efficacy. And the data about safety and efficacy is the exact same for an FDA full approval as it is for an EUA. So the
EUA, I'm sorry, Dr. Jameson.
The EUA is the Emergency Use Authorization. Thanks for clarifying that. That's what the vaccines are currently authorized under. And so the data that is available to us is the same data that has been submitted for the full authorization for the Pfizer vaccine. There's no new data that's being submitted to the FDA. The biggest thing that's holding up is mostly the logistical and kind of verification processes. So in order to be fully FDA approved, you have to do a manual verification and an on-site inspection of manufacturing and all the different routes of the supply chain. And so that takes time and manpower. And that's some of the things happening right now with the FDA. The suspicion is that that's going to be fully FDA approved in the next couple weeks, but we don't know exactly when that is. And frankly, I don't think we should have a say in pushing hard when that should be. I think that we have a lot of confidence as being the gold standard for approvals in the world because of what the FDA does. And I think allowing them to do that appropriately is reasonable. But I think it's really important to know that we're not going to have any more safety or efficacy data that is going to be added into that for the authorization under full approval from the FDA than we have right now. So I have immense confidence in the transparency that's been given, and I've had personal interactions with individuals at the CDC and from the investigative arm of the CDC that have looked at side effects and adverse events and things like that. I don't think it's completely fair to say that it's impossible to have an adverse event from the vaccine. That does happen. And one of the things that's really important is that we are transparent about that, have that data submitted, and talk about it. And if anybody's had an opportunity to watch or look at any of the ACIP meetings, which is this advisory board to the FDA and the CDC, those are clinicians that are really talking about the data, and it is immensely transparent and great. And I would really encourage people to go to some of those sources to have an idea of what we use as clinicians to make decisions for our patients and recommendations. So what other questions did you ask in there?
I think it was the last part of that was, is there anything harmful in the vaccine? And I think you're answering that in terms of what you just said. Yes, there can be something that an individual has a reaction, but it is not experimental. And maybe a little bit more around why if it happened so quickly, why is it not experimental? I think
Yeah.
the understanding of how the vaccine got developed.
Yeah, that's really good. So the vaccine manufacturers had to set up a trial that that could show efficacy when you compared people who got the vaccine to people who got a placebo. Let's say you compare it to something like the shingles vaccine. That took months and months and years to get done because shingles is relatively uncommon. So it took a long time for someone to be able to show this number of people got vaccinated and were protected versus people that got it with natural immunity or got naturally with just a placebo. Unfortunately or fortunately, we were rolling out that approval during that trial during a surge in the fall last year. So we had so many cases in such a short amount of time. We were able to show efficacy that was in a way that came out much faster than typically we can do in a trial. The vaccine manufacturers were planning on spending almost up to 18 months on that trial, but it got done much quicker because of how many cases there were, unfortunately. In terms of what's in the vaccine, so, for example, with the Pfizer vaccine, there is salt, water, sugar, fat, and then messenger RNA. That's it. There's nothing else in it. There's no preservatives. There are no extra proteins added in. The way the mRNA works, and I think this is important to kind of clarify, is it acts as like a tiny little recipe that your body uses to make a spike protein. So that spike protein then gets made by your cells with our natural body's apparatus for making proteins. And then that signal, that recipe is just destroyed right then. So we have good data showing that you can't detect mRNA simply hours after a vaccine. It's all gone because it's used by your body. And then that spike protein is what your body has a response to, so that if it ever sees COVID again, it can be ready to fight it off. And so it's a very, very very, very elegant way of designing a vaccine. And I think that that the safety, the efficacy, the transparency in the process is something that I get a lot of satisfaction and a lot of reassurance by.
Thank you. Thank you very much. I'm going to ask any of the panelists to answer our last two questions. Let's start with, in terms of tests, getting a COVID test specifically for children. We've heard from parents that they're concerned about the safety of getting a COVID test, that the swab may cause problems for the child. I know sometimes it's irritating, but also bigger problems. Someone asked, could it cause cancer? What can you tell us about the tests? And maybe I will start with you, Dr. Brown, and then just ask if each of the panelists would like to comment on the tests themselves.
So I think it's helpful to remember that the nasal pharyngeal swab that we're using, which I think is what parents are talking about that worries them, this is the same swab, same technique we have used for decades to test for influenza, to test for other viruses such as RSV. So there's nothing new or different or alarming about this. It might be a little uncomfortable, but there's nothing about it that should create problems. But I'll let Dr. Oliveiro and the others answer as well.
Thank you.
Oops, sorry, I'm just trying to unmute myself there. You're absolutely right that getting tested in the, even just the nasal test, which is a little bit less noxious as getting the nasopharyngeal test, which is the test that actually goes back further past the nasal passage towards the back of what we call the pharynx. That can be very noxious and difficult. Even the nasal swab is uncomfortable in the moment. And it gives you a sense of having something in your nose, also wanting to sneeze. It can cause a nosebleed in some children where the blood vessel gets kind of a little bit abraded there. Aside from that, we have seen no data that would support that the nasal swab itself causes direct harm. There was some concern about there being a risk of it causing cancer, but I really think that has not been validated from my research on the topic.
Great, thank you so much. Dr. Bora or Dr. Jameson, did you want to add anything?
I think some of the concerns about cancer were probably early on when we kind of had a massive shortage of some of those swabs. And I would probably say our supply chain was not amazing in terms of making sure that there was nothing scary in any of those swabs. We are in a scenario now where it is safe and effective, and it is really meeting our typical expectations for medical equipment in the United States. I would say too, though, in West Michigan, we're lucky. We have quite a few labs that are outside the health systems that do things. We have a couple labs that can offer saliva testing as well. There are scenarios where a regular nasopharyngeal swab is not a good idea for patients if they have a really low platelet count or they have a bleeding disorder, or sometimes just young kids can't do it. And so there are other options there. There are options including some swabs of the throat with like a swab of the front of the nose. So we have a lot of different ways of doing it. I would say that the tests that are molecular or something that are polymerase chain reaction, they'll say on those are more accurate than some of the take-home tests you can get from the pharmacy that are, they're called antigen-based. And so I think it's important for any of our listeners to really coordinate with their physicians about what test is best for them and then how to interpret those tests, because they're not perfect.
Thank you. That actually leads into another question about the tests that I would ask, again, anyone to answer on the panel about the effectiveness. We keep hearing these different tests, the different ways they're described. One is PCR, one is a rapid test. You mentioned a number as well. Could we have a sense of the effectiveness and accuracy of the results from the tests, depending on which tests we are taking or we are having our children take?
I can take this one because I live it, unless anybody else wants to jump in. Okay, so the big difference is if someone's symptomatic or not symptomatic. If you are symptomatic, some of the rapid PCRs you can get, which come back in about 15 minutes, and some of the other PCRs, those molecular tests, are about equivalent. The likelihood of testing positive if you have symptoms and have COVID is well over 90%, 95%. Some of the take-home tests that are the antigen tests, those are the ones where you do a swab and then maybe a couple lines show up, or you have like a digital one that says yes or no. Some of those, they are only about, if you have COVID and you have symptoms, they're probably only going to test positive about 80% of the time. So those are not perfect. If you don't have symptoms, those tests go down in terms of accuracy. And so you either have to do it multiple times and get kind of a serial testing kind of thing. And that's why there was a benefit to some of the testing of sports for high schoolers that was recommended, is kids don't have symptoms, but keep on going, you test every week. And we did that in healthcare workers in some scenarios as well. And that was really to help overcome some of the inaccuracy that comes from asymptomatic individuals. That's why it's so important to talk to your clinician and your provider about what test is best for you in what scenario, because it's really hard. Antibody tests are also another way that people can get an idea of what their COVID exposure is. That's a blood test or a finger poke. And that only is kind of a marker of previous infection and doesn't help you right now. And it doesn't help you for a few weeks because it takes a while for those antibodies to show up. And sometimes those antibodies can be positive from other cold viruses, not just COVID. So again, it's really important to interpret all those tests with your clinician and try to work together with that.
Thank you. I want to follow up quickly with one thing. The difference between the flu and COVID, you just mentioned that sometimes it can show up that way. Can you talk just a little bit more about that difference? Can we tell that difference? First of all, can we tell it in terms of symptoms? And then can we tell it when it's being tested?
So I have long ago given up trying to say that I could talk to a patient and be sure what they have by their symptoms. We've seen COVID show up in so many different clinical scenarios now that we really just have to have a low threshold for testing to try to get an answer there. So I can't. I try hard and I can't anymore. What we have seen this summer is we've seen things like RSV, and we've seen some other cold viruses like rhinovirus and enterovirus come back with a vengeance as we've stopped masking. In the last year, we had so few cases of influenza. It was pretty incredible. And a lot of public health experts and most of us in the infectious disease world think that was because of the social mitigation strategies we had with just people not getting together as much. People weren't going to work sick anymore, and also masking. I mean, and as that's drifted off, because of vaccination and things were better with numbers, we've seen some of those other viruses come back. And so it's going to be really important for people to not work sick, not go to school sick, see their doctors, get tested, and then get an idea of what they're dealing with, because there are a lot more viruses circulating now than we had previously. And so I don't know if some of the docs, the pediatricians can speak to some of that, but I know RSV has been a huge problem lately, even in the adult population. That's another type of respiratory virus that typically affects kids.
Perfect. Thank you. Yes, Dr. Brown?
Oh, I was just going to agree. After having a very quiet fall and winter, we have seen a tremendous resurgence of usual winter viruses in kids. So I agree. We're seeing a fair bit of bronchiolitis and croup and things that we typically don't see in the spring and summer.
And Dr. Brown, as we're getting close to the end of the hour, is there any other final comments you would like to make? And then I'm going to go to the other two panelists with the same question.
I think I'd just like to, again, emphasize looking out for the whole child, and also thinking about the children that are vulnerable. And so doing everything we can to help children have some routine and some normalcy, and I think to give them a little sense of control. I think it's very hard for them to feel like there's this scary thing out there they have no control over. And so I think if we teach them these things, will help keep you and your family safe, and will help your friends and your relatives. It gives them a sense of control. And I think that's important too. So that's how I would end.
Thank you, Dr. Brown. Dr. Oliveiro?
Yes, and very much along the lines of what Dr. Brown was mentioning about thinking about the whole child. I do, although I certainly care for most clinically children, and I am a parent, I also want to encourage us to think not only about the children, but to think about the larger community impact, because we all really do affect each other. So thinking about how our behaviors do impact the health of the community at large, including those who are medically frail, those who have not yet had access to the vaccine, but also in those who we know can have waning immunity from their natural infection or from a COVID-19 vaccine. That is certainly a moving target right now. And so we do need to be very sensitive to that. So coming into the fall, we need to think about the whole scenario around us and not just different parts in isolation.
Thank you so much, Dr. Oliveiro. And Dr. Bora, any closing comments?
Sure. No, I think we've just really seen throughout this pandemic that people in our community really know how to come together, work together, and take care of each other. And I think this is really the time for us to do that again and to continue doing this. And it's for the children, it's for the whole community. But as we do the things that we need to do to take care of the people around us, we're going to create a community that's healthier, that's improved mental health for everyone. And, we'll get through this, but we just all have to be able to look out for those who are the most vulnerable. That could be children who are not vaccinated. That could be someone who is who has cancer, is going through chemotherapy. It could be someone that we don't know, but they may have had a transplant and the vaccine doesn't work for them. It could be a child who has chronic health issues that we just don't know about. So we don't know all the struggles that people are facing that we come into contact with every day. And so how can we take care of ourselves and take care of the people around us? And I think as a community, we can do that. I know that we want to do what's best for each other. And so I think this is our time to really come together and make that happen.
Thank you, Dr. Bora. Thank you all, four panelists, for your wisdom, your passion, your service, and sharing with all of us what you've seen, what you know. And I just want to also wish you good luck in continuing walking with all of us as we struggle through this pandemic. I'd also like to say thank you to all of those watching this recording and participating with us today. I think we had over 250 people join us this morning, and want to encourage all of you to share with your friends, colleagues, children, family members to watch the recording with you or to watch it on their own. You can see on the screen right now the 3 places where this recording will be posted. At vaccinatewestmichigan.com, that's the first one on the left. At accesskent.com/health/, that is Kent County Health Department, and at miottawa.org/health/OCHD, Ottawa County Health Department. You can find the recording in any of those places. Again, thank you, everyone. Stay healthy, take care of yourselves and your children, and I look forward to seeing all of you in the future. Take care.